Hi, and welcome to Uniquely UCF Sociology, a podcast production of the Department of Sociology here at the University of Central Florida. I'm your host, Dr. Ramon Hinojosa. Uniquely Sociology is a podcast that explores the research and creative efforts of those who are doing the good work of sociology. You want to know what sociology is and what contributions sociology makes to improving our lives? Well, then you've come to the right podcast. It's Uniquely UCF Sociology. Today, I'm speaking with Dr. Shannon Carter, a tenured professor and associate chair in the Department of Sociology at the University of Central Florida. Dr. Carter's primary research areas are the sociology of reproduction, social inequalities, and the sociology of health and medicine. She has received numerous awards, including the Gloria Anzualda Research Excellence Award, the Woman of Distinction Award for Excellence in Innovation, and has been inducted into University of Central Florida's Scroll and Quill Society in recognition for her contributions to scholarship. She is currently the chair of the Gender Division of the Society for the Study of Social Problems and serves as a member of the advisory board for social inquiry. Hello, Dr. Carter, and welcome.
Hello, thank you for having me today.
Yeah, so I'm glad you're able to take your time and chat with us. We're very excited to hear about your work and talking about sociology and how it improves people's lives. So let's begin by asking where you attended school for your PhD, and maybe if you can remember a little bit about your dissertation work.
Yeah, so my PhD is from the University of Florida.
Woo, go Gators! Woo, woo.
My dissertation was on women's pregnancy and childbirth experiences and sort of the meanings that they attribute to that and how they made sense of their bodies in connection with the reproductive process.
Excellent. And so your work on the sociology of reproduction, I will assume, still continues to draw on those early efforts?
Yeah.
Okay. So maybe you could tell us a little bit about what the research is that you're doing now.
Yeah, so the research that I'm doing now has shifted more to looking at breastfeeding in particular. And breastfeeding is really the site at which I look at a variety of social processes. So social inequalities, the formation of communities, and through my work on breast milk sharing, bio-communities of practice is what we've called them. So it focuses more generally on the social aspects related to breastfeeding and how that is connected to the broader trajectory of reproductive health.
So tell us how breastfeeding is linked to inequalities in society.
Yeah, so there's several ways. First is that breastfeeding is often considered its own distinct parenting behavior, right? It's often like the World Health Organization and various elements within the United States, like Healthy People 2020 objectives, constantly are setting up measures of breastfeeding and goals, right? So we have a goal that we want X% of childbearing women to breastfeed to 6 months. And that's considered that sort of, first of all, that everybody has the same opportunities to breastfeed, right? Which we don't. It takes time. It takes time with the child, time home from work. We don't have a lot of social support for breastfeeding in terms of lactation support. A lot of women, like if they give birth in a hospital or even in a birth center, they'll have breastfeeding support where a lactation consultant might come once during their stay and help them breastfeed initially, but the milk doesn't actually come in until several days later when they're home. And in the United States, we don't really offer people as part of the healthcare package at-home lactation support. So that's something that someone has to seek out and pay for privately out of their own pocket. And so that's one of the ways. But also, breastfeeding is part of the reproductive process. And so reproductive health care begins in pregnancy or sometimes even before. and people aren't treated equally within the reproductive healthcare system. So we have vast inequalities based on race in particular, also socioeconomic status and other factors. And so none of that's really taken into account. So when the Surgeon General of the United States or the Healthy People objectives are that we want to increase breastfeeding among African American mothers, it doesn't really pay attention to the way that African American mothers are treated in the broader maternity care system. So they're 4 times more likely to die in childbirth. Their infants are 2.5 times more likely to die before their first birthday. And it's easy to point the finger at them and say, oh, but you're not breastfeeding, right? And that was really our objective, and to sort of ignore the way that racism is, systemically embedded in our healthcare system.
So we know that there's currently a child formula shortage in the United States. And so your work would seem to suggest that that's likely going to hit certain groups more than other groups. Is that correct?
Yeah, absolutely. So the formula shortage, of course, that's what I listened to on the radio on the way to work this morning, right? It's what everybody's talking about right now. People are spending hours searching for formula. They're calling stores ahead of time, driving to the store. They have formula when they make the phone call. By the time they arrive to the store, the formula is out. And so obviously that's going to hit people with fewer resources harder, right? Those who don't have their own form of transportation, who rely on public transportation. I'm sure there's inequalities in which stores are getting formula stocked, which locations they're in more quickly. And then, one of the things that people are doing is turning to the internet, right? Mothers are helping other mothers, people are helping people. So somebody might have some leftover formula that, in the cabinet that they're not using. People are getting formula that way. And that actually connects to one of my other research projects, which is on peer breast milk sharing. There's high demand right now for breast milk, anything to feed a baby, right? So breast milk, it can be milk from a milk bank. So I saw on the news that the Mother's Milk Bank of Florida is sort of overloaded with people donating milk, which is amazing, right? And then they process it and they distribute it. So there's an increased demand for that, but also people who just share breast milk with each other through more informal means. And that was another line of research that I did. But of course, that is connected to social inequalities as well. Like first as a marginalized practice that is not recommended by the US FDA or the AAP. And then secondly, as something that takes an extraordinary amount of time, both for donors and recipients, because we knew that babies eat, a lot every 2 to 3 hours, right? And so to be able to feed an infant another person's milk, the recipient is constantly searching and often driving all over town to pick up milk to acquire enough to be able to feed their baby. So we have a huge baby food shortage, right? Infant food shortage. And these are sort of the different ways that it might play out.
Interesting. So it sounds like, and correct me if I'm wrong, that your work is really the intersection of culture and biology as much as it is about the sociology of health and illness. Is that correct to say?
Yeah, absolutely.
Okay. So if students or potential students in our audience out there are listening to this and they decide that they'd love to come to UCF and study with you, what sorts of things might they expect to do?
Yeah, so I involve students in a lot of my projects. I work with undergraduate students and graduate students. And there's really, an array of opportunities, often depending on the student and their expertise and their interests. So some students come to work with me and they already have an idea of what they want to do. And that might be connected to the research that I do in reproduction, or sometimes it's even just connected to some of the perspectives and tools that I use. So I have students who use critical discourse analysis, right? And they might apply that approach to something that is not necessarily related to reproduction. But I tend more often to work with students who are interested in some way in studying reproduction. So I mentor a lot of students in their directed projects, what they come with an idea that they want to study. And that can vary, like some of the projects I'm working on right now or have worked with master's students. One is looking at abortion legislation, especially abortion restrictions that were passed during COVID as part of like emergency legislation. I had another student who analyzed racialized images of birth control in women's magazines. So things like that. I also have students who work on projects that are more connected to what I'm doing. So we might work more collaboratively using my data. I have several data sets on interviews with African-American mothers and their breastfeeding experiences, interviews with women who engaged in milk sharing. I have interviewed data collaborative project with my colleague in the Lindsay Taliaferro in the College of Medicine, looking at transgender young adults and how they navigate healthcare systems. And so Lindsay's more interested in some of the mental health components. I'm more interested in the reproductive health components. And then we have students who are interested in a wide array of things. So I collaborate in a lot of ways like that, or just, overseeing students in their own data collection projects.
Excellent. So it sounds like this is very interdisciplinary work that you do with some students. Other students might get solid methodological perspectives from you, and other students might work directly on your research. So what do these students typically go on to do with their careers?
Yeah, it really depends on what they came to the program to do and what level they're at. So most of the PhD students who I've graduated have gone on to work in academic careers. That's sort of what they set out to do, and that's what they have done. I have other students who I worked with who received like a master's degree, and they've gone on to work with different reproductive justice organizations, a lot of community outreach and community work. And then I work with a number of biomedical sciences undergraduate students, and they tend to go on to medical school.
Excellent. And so for the listeners out there, if they wanted to get a sense of the research that you're doing, either current research or past research that you'd like to highlight, is there one article or one piece of creative work that you can think about that you might like to share?
One is a book with Dr. Reyes Foster in the Department of Anthropology at UCF. And our book is called Sharing Milk, Intimacy, Materiality, and Biocommunities of Practice. And that was really the culmination of so much work that we did for many years on peer breast milk sharing. We did 4 years of ethnographic engagement in the community, and these are communities that are both online and face-to-face communities. They operate in both realms. We did a survey of about 400 parents who participated in milk sharing, and we conducted in-depth interviews with 30 mothers who were participating in milk sharing at the time of the interview. So it's really a culmination of a lot of work, and we engage in that book really sort of theoretically on what it means to share milk. I mean, we think of like feeding an infant is just like, well, feed the baby, right? Like they need to eat. And so you feed the baby, but when people engage in peer breast milk sharing, it is an immense amount of labor, like I mentioned earlier, dedicated to feeding infants a particular way, right? And so there's a lot of emotion connected to that. Often one becomes a breast milk recipient because they tried really hard to breastfeed and they were unable to, or they were unable to exclusively breastfeed. And so there's a lot of like emotion tangled up in that. And then a pure breast milk donor puts forth an immense amount of labor, right? Like embodied labor to produce extra milk for the sole purpose of giving it to someone else to feed their baby. And so it's incredibly connecting experience. And so that's what we talk about in our book, and theorizes sort of ideas of bioconnectedness through the material substance of milk.
Okay, well, that sounds like fascinating work, and that's a new publication. So what I'll do is I'll put that article in the link below. So for those audience members that would like to take a look at this new research and give some thought to some of these new ideas and ways of looking at breastfeeding, that work will be there for you to take a peek at. So Dr. Carter, I would like to thank you for your time today and chatting with me and our audience.
Thank you.
And I'd also like to thank you, our audience, for taking time from your busy day to listen in as we discuss all things that are uniquely UCF sociology. This is Dr. Ramon Hinojosa saying thank you, and we hope you'll join us next week.